And Jen, if you're there, we'll let you go ahead and get started.
Hi, everybody. Welcome. And as Mary said, I'm going to ask a few questions and I encourage you to use the chat. It would be great to hear your responses. That would be wonderful, just so we can see whatever it is that you would like to share with us. But yeah, Mary and I, when we first put this program together, we did not know that there was going to be all this wild weather that we're experiencing. But gosh, it sure did make me think about everything that we've been through in the last 18 months. It's felt like tornadoes and rain and then it's sunny over. I'm on Kent Island and now it's sunny over here. So it's been up and down and up and down. And so hopefully this evening is going to help you look at the future in a very optimistic way as a family caregiver. So what I want to ask you for today, to think about prior as a family caregiver, whether you're taking care of your husband or your uncle or your mom or whoever it might be, on a scale of 0 being no stress and 100 being the highest amount of stress you could ever have, where would you put your stress level? Where would you say that you were prior to March 2020? So I'll give everybody who would like to write in and share a moment to write in our chat section for those of you who are joining us live. So I'm going to take a look. Feel free to write in. Where would you put your stress level prior to March 2020? Because of course, we know that caregiving is incredibly stressful, whether you're taking care of somebody who has Alzheimer's or somebody post-stroke or somebody who has a disability. Okay, so somebody's saying 5. So Laura, I'm wondering if you're saying, Barbara says 80%. Laura, I'm wondering if you're saying 5 or 50, because 5 would be pretty good. Karen's saying about 50%. Angie's saying 30. So we're all over the place. I like to say, okay, so 5 out of 10, so about a 50. So Angie, if you would like to write in, Angie, I'm curious why your stress level was so low, if you have any secrets that you would like to share with us. But obviously, with everything that happened since March of 2020, so many of us have struggled. Even Joanna just said it's 75. We've struggled even more because of the stress, the uncertainty. And let's take a walk back. And I can't believe that it's been 18 months, but it sure has been about 18 months. So back in March of 2020, we were told to social distance. Never in our lifetimes have we been told that we need to keep 6 feet apart from other people and you want to limit who you're around. And everybody, we were told some pretty scary things that maybe 3 to 5% of us were going to die. And it was a very terrifying. And you may, I still remember feeling so nervous, like about going to the grocery store. And I remember when I was in New York City right before March, actually on February 29th of March of 2020, because it was a leap year. And I was there for an event, and I remember there was just a buzz and energy in the air that people felt like a lot of news reports were talking about COVID and would it really be an impact on us? And sure enough, we started the lockdowns and mandates and a lot of coverage. That's almost all that the media could possibly talk about. And then it started to get lots more. Could you get it from surfaces? Should you keep your mail outside? Make sure you're washing your hands for, anybody who maybe has worked in healthcare. We know all about washing hands, and most people do wash their hands, but really be vigilant. And hand sanitizer. I remember going into a pharmacy and not being able to get hand sanitizer, which, by the way, I used prior to March of 2020. And then came the masks, and then I remember almost like daily, it was like, okay, you can't have an event with more than 100 people. You can't have an event with more than 50 people, 20 people, 10 people. And so it was mass panic. We were all panicked. And so you, especially you, the caregiver, you were already dealing, maybe you were at a 75, or maybe you were at a 50, or even if you were at a 30, I'm guessing that it's likely that your stress level went up because of all of this, adding to it and thinking to yourself, well, if my mom is in a senior living community, is that okay? Should I take her out of the senior living? I had friends calling me and saying, do I bring my parent home? Do I bring my loved one home? Is it a safe place for them to be right now? Or maybe you were on the verge of hiring an aide to come in and help you. Or maybe you had friends and family that were helping you out in the home. And you decided, you know what? I'm not going to let anybody in because you maybe did a cost benefit analysis on what we knew at the time, and it's just not worth it. And so I'm guessing your stress level definitely went up during that time. And if there's anybody on who's saying, nope, it didn't, I'd love to hear your secret. And then we get to December, January, and we think, wonderful, the vaccines are here. This is going to be great. This is all going to be over. And of course, now there's talk of even needing a booster, which nobody was expecting. And it's fascinating to me to watch this unfold. In the last 2 weeks, it was said 8 months. After 8 months, you need a booster. Then a couple of days later, it was 6 months. And now we're hearing 5 months. And so lots of messaging that's been really, really stressful. What makes sense? What doesn't? How do we make these decisions? And how do I keep myself, my loved one, as healthy, happy, and safe as possible while keeping my stress level low? So a really tough time if you've been a family caregiver. And in addition to that, I know that many of you have jobs. Maybe I remember in the beginning of the pandemic when everybody was told to stay home and most people were working from home. And well, not most people, but most people that have office jobs were working from home. I know probably many of you who work were out and about. But I remember that there was one woman, I did an event, a family caregiving event, and there was a woman on that event who had, prior to March 2020, for over a year, had her mom lived with her, but mom was in adult day. And as soon as the pandemic hit and the lockdowns started, her mom, daycare closed, and the woman had to be working from home. And so now she's on lockdown 24 hours a day with her mom who has Alzheimer's disease. And she was just saying how utterly exhausted she was. Her mom actually tried to climb out of a window in her house. And she said, I had done the right thing. I went and got myself some help. And now I don't have that help anymore. And how the heck am I supposed to keep an eye on her, make sure she doesn't wander out a window or a door if I'm supposed to be working at home? And so people were put in such incredibly tense, stressful situations. So what I like to invite everybody to do is to tell us if you have experienced any negative feelings due to the pandemic-related changes, whether back in March, whether over last summer, whether you're still feeling negative feelings. And truly, this is not a trick question. It truly is not, because I have actually talked to people who have said that their life hasn't really changed all that much, that they still see the same people. They never really went out too many places. Maybe they have a live-in help with them, and they haven't had an increase in any bad or negative feelings. And I think that's amazing and remarkable, but I think it's very unusual. So I'm looking at the chat and trying to see what everybody's got to say. Yeah, people are saying, it's okay, 90%. But what I'd like is if you could just put a yes or no. Did you experience an increase in any negative feelings whatsoever, that your mood was impacted negatively? So just take a moment to write yes or no. Oh gosh, Laura, I'm so sorry. Yes, not being able to go see your loved one in the hospital. So yes. Beverly, yes. Okay, I have not seen a no yet. I'm so sorry. Susan says anger. Angie says yes. Laura, I'm so sorry. Your husband almost died and you couldn't see him. It's terrible. And Susan's saying fear. So what we're going to do now is I'm going to invite you all to look at some difficult feelings and to think about whether or not what you have experienced. We're going to do that in a few moments. So it looks like most people have experienced difficult feelings. So if you've had a negative emotion, wow. Okay. And Barbara's saying that, oh gosh, Karen, I'm so sorry. Mother-in-law hospitalized 5 times, rehab 3 times, all in lockdown. She passed away on Thanksgiving. How awful. I'm so sorry. And now your husband's sick. Barbara's saying her husband and she take care of mom full-time in your home. So if you did, which it sounds like everybody did, at least everybody who wrote in is having some challenges, I want you to remember what can compound your negative feelings is that they may be different from other people's difficult feelings. So some people wrote in that, and we're going to talk a little bit more in detail about those difficult feelings, but some people wrote in that they were very afraid or very angry. Other people in your life or other people that you encounter may have difficult feelings, but in a different way, on a different kind of emotion. So just please keep in mind that that sort of tension can also create and compound your stress level. Angie's saying mom's facility locked down multiple times. Yeah. And I'm sure you've all read the stories, people getting jobs where their loved one lived so they could see them. It just so much upset, so hard for people just trying to do the best they can to care for their loved ones. So remember that if you're a pretty laid back person, which some of you may be, maybe you're naturally Zen like my husband. That's why we're a good match, because I'm not. But it might be totally brand new to you, whatever emotion has come to the surface or emotions, especially when you put on top of the stress of being a family caregiver. Your feelings might be more intense than they've been previously. And also during this time, a lot of us were robbed of some of our favorite healthy coping mechanisms. You remember there was a period of time where the gyms were closed, senior centers closed for a period of time. Going to get a manicure was not possible. There were even public health officials saying, don't walk outside. I mean, there was so much messaging that was making people so nervous. Like maybe you got scared of walking outside in your neighborhood because what if you encounter somebody else? Maybe you live close to a lot of other neighbors. So think about it. You already have caregiver stress. And many of you said your numbers were 50 or higher. Then they take away all these coping mechanisms that a lot of you relied on, or services like you knew you could visit your husband, or of course you'd go to the hospital with your mom if she fell. And those are very comforting things that we can do. We can keep our eye on our loved one. So it's no wonder that you've had difficult emotions. So what I'd like to invite everybody to do now is we're going to talk a little bit more in depth about those difficult emotions. So I want to invite you to grab a pen and a paper, or if you want to open up a Word document, but it could be just a Post-it. I want to ask you to jot down some words. So we're going to go through a little exercise. I'm going to give you a moment to do that. All right. So let's get started. So I'm going to first show you some words, and I want to talk about these different feelings. So A, scared. And if you felt during these last 18 months scared or worried or tense or edgy, I want you to write that down, either A or scared. And this could be for a whole lot of different reasons. Scared that you're going to get COVID, scared. I know a lot of people that were just terrified, not for themselves, but I'm going to get it. I'm going to give it to somebody else. And I'm scared to death that that's going to happen. Or I'm scared that my loved one who is in a community is going to die, which actually happened to some people that are on this program right now. Or I'm scared that the world will never get back to normal. Or I'm scared that my child who already struggles with learning is going to be set back for the rest of their life because of online school. So if you experience feeling fear or feeling scared, please write that down. The next one is hopelessness, feeling desperate or unmotivated. Things won't get better and you don't see a way to improve the situation. Maybe you have felt experiencing hopelessness during this time. Sadness, just feeling low, just feeling depression feelings. And depression feelings have been reported much higher since March of 2020. A lot more people are reporting depressed symptoms. And this is a natural one because we as human beings are not meant to be by ourselves. We are absolutely meant to socialize and to be around other people. And if we are not doing that, for a lot of people, that's going to create feelings of sadness. Maybe you're feeling sad because you missed holidays, or maybe your loved one's big 75th birthday or 100th birthday, or maybe you were sad to miss, maybe you had a big vacation planned, or maybe you lost somebody, which some of you mentioned, losing a loved one during this time, or sad because there was so much time had gone by since you saw your loved one. And then when you finally saw that person, he or she had declined a lot. I've heard that from many family caregivers, that when they finally laid their eyes in person on their loved one who was in a community or a facility, that they felt like that person had just gone downhill so much, that there's a lot of sadness observing that. Yeah, Laura's saying, canceling your dad's 80th birthday, something that should be a celebration. These are the types of things that make life joyful. And so much joy has been taken away from life during this time. Anger. I remember over the course of the last 18 months, there was a friend of ours whose wife had to go to the hospital, not COVID related. They're in their 60s and they've been married 40 something years. And I'm going to call her Mary. When Mary was in the hospital, she gets there, gets dropped off, and she texts her husband, says, "Oh, well, they're keeping me. You can't come in." And I'll call her husband Joe. And so Joe feels angry. He's like, "What? I can't come in. This is terrible." And then later that day, he calls and he, doesn't get her on her cell phone, texts her, calls her room at the hospital, gets put through the room, no answer. So he starts becoming very upset and wondering, where is she? And we all probably have been there when we've had a loved one in the hospital. A lot of us feel like, oh, what happened? But a lot of times it's just that person's getting tests, or they're in the bathroom, or they're seeing the doctor, something like that. And when he called the nurse's station at the hospital, the nurse said to Joe, "Well, I can't confirm or deny if that person is here at our hospital, unless you provide a patient code." And he says, "What are you talking about? What patient code? I don't know. My wife's there. I would be there with her under normal circumstances. In fact, not only would he be there, but probably all their kids would be there. Their grandkids would be there." And he was just furious. And he and his wife actually wound up getting into an argument about this goofy patient code when she finally got back to him. And because she's already feeling lousy, she's in the hospital, she's nervous herself, and she's like, what are you kidding me? I don't know anything about a patient code. And so there was a lot of anger that, why are you keeping me from being an advocate for my loved one? Loneliness. Again, so please be writing down what feelings most associated. So did you have any anger during this time? And this could be any time during the last 18 months. Did you have any feelings of sadness, any feelings of hopelessness, any feelings of being scared? And now we are at loneliness, isolation, feeling like you can't relate to others. And it could be from just spending a lot of time by yourself and feeling disconnected from other people and not being able, again, one of the worst things that we can actually do to somebody is isolate them. And we have really been isolating from each other. And a lot of people, even when vaccinated, are still feeling like they can't be around others, and they're spending a lot of time by themselves still. So feeling disconnected and lonely, is that something that you can relate to during the past 18 months at any point? Frustration, just over it. I've heard so many people say, "I'm just over it," exasperated. I'm just done. You know, I can't do this anymore. I'm just so frustrated because some of this just, you know, they feel like they're taking steps to move forward, and then something new happens and they just feel frustrated and over it. So F or frustrated if you've experienced that feeling. G, confusion. Can't comprehend why certain rules are being made. Feeling baffled. And interestingly, a lot of people have pointed to situations where they have seen public health officials or government officials who have made rules, but then maybe didn't follow those rules, or made mandates and didn't follow those mandates. And so creating confusion, or when messaging changes. And for one example that's come up in the past couple of weeks is with the booster. And initially, I think a couple of weeks ago, it was like, okay, at 8 months. And then all of a sudden, a couple of days, maybe a week later, it's nope, 6 months. And then it's 5 months. And so people are confused. There's a lot of confusion about the messaging that's going on. So if you've felt any confusion during this time, feel free to put that on your list as well. Distrustful, unsure what to believe. You don't know what to believe. Different experts have different opinions. Or maybe you've done a lot of research and you're just not sure about how you feel about certain things that have been going on. Maybe you're feeling cynical. So feeling a distrust. There's a lot of data that suggests that trust in the healthcare system has dropped quite a bit. Now, the trust for your individual healthcare provider, most people will say they still trust that person that they have a relationship with, but that they don't trust the quote unquote healthcare system. That's what a lot of studies are indicating right now. So if you've experienced any feelings of distrust, one that I had a friend, one of my friends who had called and said, should I move my mom out of the senior living community? I remember in the beginning, I think it was maybe May of last year, my friend called me. Her mom remained in the senior living community. And she called me and she says, I don't trust the numbers. They're telling me that there's not that many people in the community that have had COVID. I think it was like 3 people. And this friend, her mom lived in a very, very large community, very large, hundreds of people live there. And she just didn't believe them. And I said, I really don't think that there's a reason to not believe them, because, you've always trusted them in the past. They've always taken really good care of your mother, but she was just not trusting that they were being honest about the number of cases of COVID that occurred in that community. So lots of people have experienced different reasons and different feelings of distrust. So if you can identify with that, write that. Overwhelmed. And I know many of you were already overwhelmed. If you were at a 7, to me, if you were over a 50 on that 0 to 100, if you were over 50, you were overwhelmed. Okay. If your stress level was over a 50. So most of you said you were already overwhelmed. And now it's with everything, all the changes. So having healthy coping mechanisms taken away from you, feeling maybe like you have to do more of the care because you didn't know if you should bring an aide or help into your home, overwhelmed trying to keep up with the changing information. So if you have felt overwhelmed during this time, I want you to write that down as well. Randy says, my husband is a transplant patient, got the shot. And because of the anti-rejection medication, it's not working as well. We take care of my 95-year-old mom with dementia. Yeah, I'm so sorry. I'm so sorry that that's going on for you. It's a lot. It's a lot. I feel like caregivers just have had so much. Being a caregiver before all of this was tremendously stressful. But now it just, with everything, I'm sorry you went through that or you're going through that, Randy, that stress. Helpless, feeling helpless, that you can't change anything, that you're unable, you're at the mercy of other people. You feel powerless, you feel immobilized. That's something that a lot of people have experienced. And I've heard that today. I was talking to some friends that were feeling really helpless about what was going on with their child's school, what the rules that were happening, and that they didn't feel that it was in their child's best interest. And the way that they're handling the new school year, they feel really helpless and powerless and unable to make any changes. And maybe some of you have felt like that about what's going on with your child's school, whatever it may be. So if you have experienced feelings of helplessness, I want you to write that down too. So most of you have said yes, that you've had negative feelings because of the pandemic, increase more so than before. So what I want to encourage you to do is, if you wouldn't mind writing in the chat section, what impacted you the most? What feelings did you identify with the most? Feel free to write in the chat section. Which ones came to the top for you? And feel free to share specifics if you would like to. Beverly said, I'm still livid after 8 months that while I was locked out of mom's facility, protect the residents, mom got COVID from a staffer. Luckily she survived, but still. And here's the good news, Beverly. Listen, COVID is very dangerous, particularly for older adults who, especially those who have difficulty with their immune system. But in an institutional setting, which an assisted living or nursing home is considered to be, approximately 94% of people survive. Now, I'm not so Beverly, thankfully your mom was in that 94%. Still, we don't want older adults to get COVID, of course, especially those who have maybe a lot of health issues going on. Joanna says her biggest one is overwhelmed, stressed, burnout. Angie says loneliness and isolated. Oh, Val says the same. Randy says fear and worry. Barbara says sadness and overwhelmed. Karen says overwhelmed, tired, sad, frustrated, lonely, and distrustful. And if anybody would like to elaborate, Susan says overwhelmed, frustrated. My parents, who are 91 and 86, have chosen to live by themselves, and the only plan that they have is me. Yeah. Beverly's angry, frustrated, and helpless. Okay. Feel free to keep writing in. So what we're here to do this evening is try to figure out how to move forward, how to try to deal with those feelings and get ourselves to a place where we can manage them and we can start to feel better. Laura is saying, I think I was overwhelmed and angry as well as scared. I'm a full-time educator, and what people expect from teachers is crazy. Virtual school was hard for teachers too. So I had my family to deal with on one side, and being there for the students, it's just too much. Absolutely. And I know so many people are lashing out at the teachers, and a lot of teachers are just as fed up and exhausted as everybody else is. So Laura, thanks for writing that in. BJ says worried, tense, anxious, nervous, sad, angry, disconnected, confused, need it to be over. And Karen says hopeless, resentful, misinformation is totally sad. Yeah. So what we're going to do is work toward making your life the best it can be while we're dealing with all of this. Okay, Barbara's saying you're on disability and retired, and you can't really take care of yourself with your mom, but you were able to get daycare. That's great. And God willing, the daycare centers will not close again. God, please, because you need them. We need them. Okay, so let's talk a little bit of how do we look. And before we talk about moving forward, one last question that I wanted to ask about: have you had any disagreements, whether they're in your head or verbally, with anybody? So I want to ask family, friends, spouse, partner, the person that you're caring for, your loved ones' care professionals, your own health professionals, media, public health officials. So if you've disagreed with anybody, and again, it could be in your head, or it could be you actually had a disagreement in the last few months, I'd like to invite you to share. Okay, Barbara's saying your family and your spouse. your loved one's health provider, spouse, the person that you're caring for. Randy's saying loved one's health provider. Friends, Angie's saying friends. The facility managers, your loved one's facility managers, Beverly's saying. Spouse and family, Karen's saying. Because, and I'm guessing that some of you have had the argument that, yeah, and BJ, yeah, your loved one has dementia, so he's not gonna be able to understand you. Yeah, oh gosh, Laura's saying, disagreeing with husband about his continued care, your parents, that you went to school today just to have it canceled. And I'm curious if it was because of the weather or because of some COVID policy, Laura. I don't know where you teach. But here's the thing, is that, friends, whatever difficult feeling you're having, it's very likely that other people that you know are also having difficult feelings, but they're not always the same. There are so many different opinions about what is going on. And so that creates discourse too. So what we've seen so much of is that you're caregiving, you're exhausted, you're stressed, then, okay, great. You know, you maybe you've got some help, but that you've got all this stress of the pandemic. And then when you go to family or friends or your spouse or your partner, and you go and try to talk to them or maybe vent to them, a lot of times maybe they don't see things your way. So for example, it might be, I've talked to family caregivers whose family members or siblings were furious. Why would you consider bringing a home care aide into the home for mom right now when, that person could bring COVID? And I mean, they're fighting over stuff like that. And then they totally disagree. And now those kinds of fights and arguments and conflict certainly happened before COVID, but all this business about COVID has made it much, much, much more tense and divisive, unfortunately. So your stress level today. So we talked about your stress level prior to March 2020. I want you to think if your stress level is higher or lower. And I'm guessing from what everybody is saying, if you want to share what your stress level is, we're going to go ahead and feel free to share today, which we're recording on September 1st, 2021. Feel free to write in if you would like. Now we're going to talk about how do we move forward? How do we live our best possible life under these very continuously trying conditions? Yeah, people are saying never been higher. Karen, 99. And that's not good for our physical health. It's not good for our mental health. It's not good for your cognitive health to have that level of stress. Barbara's saying 100, Randy's saying 75, Karen's saying 70. So what do we do? Okay, so I want everybody to remember and acknowledge that whatever you're feeling, it's normal to have difficult emotions since last March. It is normal. It's very, very hard. There have been a couple people who have said, nope, I've been fine. I'm really not experiencing any problems as a result of all this. And that's great for them. But most people are really suffering. So know that it is normal. So acknowledge that for yourself. Acknowledge that it's normal to disagree how others are seeing what's going on in the world and policies. It's normal. There are a lot of different opinions on what is happening. What I want to encourage everybody to try to do, and I know that this can be very hard. So wherever your thoughts are, wherever your opinions are, and I know this takes a lot of energy and patience, which a lot of you probably don't have at the moment, is try to have empathy for where that person is coming from. What if they, and I think a lot of times right now, if you do disagree with your siblings or your spouse or people in your family about what's happening or how you're caring for your loved one, try to remember that most likely they're not trying to create problems for you or maybe it's genuinely that you just see things in a different way. And I think that that's been one of the biggest tragedies of what's going on right now, is because people are so locked in to the way that they feel and the way that they think and the way that their point of view on what's going on now. And I think there's a lot of difficulty having empathy for other thoughts about what's happening. So just try, even if you, 75, yeah, okay. Val's saying she's dealing with a lot of insurance issues. Barbara's saying, after meeting with your mom's memory doctor today, it's been so tough. Acknowledge that whatever favorite coping mechanisms that you've lost, if you've lost any because of what's going on, and think about how you might be able to replace them. And allow yourself opportunities to vent and express yourself. Now, I know that this can be challenging right now. And let me go back to the example that I was sharing about the family caregiver whose siblings were furious that she opted to bring a home care aide in because of the fear of COVID. It maybe isn't going to be productive to have long conversations with that sibling. If you're the one is responsible for mom's care and you need to vent, it might be better to talk to someone that's going to validate your point of view, a friend, somebody, or a therapist or a support group that, you understand that your sister or your brother does not agree, but sometimes if you spend too much time pushing the reasons that you're doing something onto somebody that disagrees with you, it can sometimes make you feel worse. But you want to allow yourself the opportunity to vent and express yourself. We all need that. And when you're a caregiver, most caregivers, the reason I wrote Cruising Through Caregiving is because most caregivers already put themselves on the back burner, and eventually they do get into a support group, or they see a therapist, or they seek senior living or home care. And a lot of those coping mechanisms, listen, virtual is great. I mean, I love doing virtual events, but there comes a point, a lot of you, I'm sure, saying, I can't wait until we start going back to in-person caregiver support, in-person meetings, in-person, where it's normal, where people are not covering their faces. And I'm sure, because we as human beings, we want to see people's smiles. We want to connect with other people. So, and so know that even though it might not be what we usually would have, get involved, find a place where you can truly vent and express yourself. But if you're conflicting with others, it may be not as productive to argue with that sibling who thinks you're putting mom at risk unnecessarily, if you feel that that's what you need to do for you and your loved one. Also, what's really important right now, and I hope everybody takes this one really to heart, is I want everyone to really think about acknowledging what's not working for you and your family. And so maybe you were of the school of thought that it was too dangerous to move mom to senior living last July. Well, now the vaccines are not perfect. We understand that, but maybe now the risk benefit analysis is it's appropriate. Let's move mom to assisted living. The risk of going somewhere where there's other people, maybe there's going to be a lot of benefits that mom's going to get out of that. The socialization, the healthy food, you're going to get more of a break. So think about what's really, really not working for you and your family. Because I think a lot of us, no matter whatever we all thought about in terms of way to keep ourselves safe and our loved ones safe, there has to come a point where you have to do sort of that risk benefit analysis of, okay, and I remember thinking back when all the lockdowns started to happen, and when the gym shut down, and I remember thinking that's going to be really hard for a lot of people who that's their coping mechanism. They love to exercise. Isn't there a way to safely keep gyms open? And I know that there are some people that maybe will never go back to a gym, even though they really liked it, because they're just too overwhelmed with what if. But in terms of bringing help into the home, I think it's really important to think about what is appropriate for you and your family at this time. What kind of course correcting can you do? And it might be, maybe if, hopefully, God willing, the daycares do not close, but if a daycare does close, maybe, okay, if that does happen, maybe you will take the plunge and look at home care, or maybe you will look at the senior living, or maybe you're going to really make sure that other people in the family and friend network are participating. Now might be the right time. And the thing about making decisions as a family caregiver is you really do have to weigh not just physical health. Yes, you want to be careful about COVID, all that, for your loved one, for yourself, etc. But if you've taken reasonable precautions, if you need some of those services, you really need to do a risk benefit analysis. What's going to be good for your physical health, your mental health, your cognitive health? What's going to be good for your loved one's physical, cognitive, and mental health? I know you're struggling, and all of you have been really, really candid in telling Mary and I how much you're struggling. Talk to your doctor or your primary care practitioner, whether that's a nurse practitioner, a physician's assistant. Consider talking to a psychotherapist. Maybe it's a time that you need a care manager that can manage your loved one's care. Talk to the area agency, talk to Mary and her team, but reach out, look for help during this time, because, and I know that it can be challenging because getting an appointment with your doctor can be tough, especially in person, and getting an appointment with a psychotherapist can be tough, but it's worth doing the research. It's worth asking around, or a virtual support group. And again, I know life is not meant to indefinitely be lived on Zoom. It's just not. We need face-to-face interaction with other people. It's good for us. But maybe right now, if that's what's available, do something virtually. But know that these are out there. So where do you find a care manager? Okay, great example. I'm gonna, if you go to caremanager.org. Oh, and Mary just wrote in that she can give you some names. Care managers are a wonderful, wonderful resource. They can help you figure out and do some of those cost benefit analysis, like what risks are worth it if you're really stressing out. Yeah, Randy's saying all the doctors want to do is give out pills, and I need to have my thoughts together. Well, I got to tell you, I've been a therapist. I'm not a physician, but I've been a therapist, and therapists want to just talk. So, you don't have to talk to your doctor, but you could talk to a good therapist, or just ask your doctor for a referral to a therapist. Or Mary and I can also send some suggestions your way as well. So know that there are resources. Is it the same that it was in March 2020? No, not necessarily, but there are resources that can help you. Stay informed, but limit unnecessary triggers. Watching CNN and Fox News and MSNBC and all of that all day is probably not good for anybody. You want to stay informed, you want to know what's going on, but being on social media all day, probably not good for all of us. So you want to find out what's happening, what's going on, but just try to limit. And I think most of us, if we consume just what we need to stay informed, like today with the weather, I freak out when I see tornado warnings. I'm like, I just think about the Wizard of Oz and how scary. And but I stay informed. I look at the weather. All right, cool, okay, and then I just, I keep my eye on it, but I don't want to watch it all day. If I watch the Weather Channel all day today, that would probably not be good for me. I don't know if anybody else out there is like that. Yeah, Randy's saying stay away from the local news today. Thanks, Randy. I appreciate that. So then there was a study that came out in March of 2020 that anxiety and uncertainty of intolerance went up the more we consumed media. Big surprise, right? Everybody, it's so funny when we do some of these studies. It's like, of course, the more that we're on the media. And the one thing I will say about media, I'm fortunate enough that I have the opportunity to do a lot of media. I do radio, I do television, I do, I'm quoted, I'm in a lot of publications on caregiving and healthcare. And I got to tell you, one thing that I learned in the last 5 years since I started being a media contributor is how often the headline doesn't necessarily match what I'm going to say. And that you've probably all heard that adage, if it bleeds, it leads. A lot of times, like, I'll be giving some good news in a story or on a television show, and the headline will look something scary, but ultimately I'll say, just to give you an example, like, do you have dementia? Are you losing your memory? And I'll come on and say, oh, okay, well, these are the things that you don't need to worry about. So just keep that in mind. Headlines can be really scary, and sometimes the actual news isn't as scary as we're expecting. I thought it would be helpful, though, to give everybody some real data, just to put things in perspective. Over 600,000 people in the United States in the last 18 months have died with COVID. So they have had a positive COVID test. So whether that was the only thing that contributed to their death, most of those people did have many several comorbidities. But I wanted to put this in perspective because I wanted everybody to see. So that's very scary and it's very upsetting. And I know lots of us have lost people that we know with COVID. But to put it in perspective and try to give you a little bit of peace, we've had almost 40 million people in the United States be diagnosed with COVID. And so I know it's awful, but just to keep that in mind, that the headlines, most people that have COVID, and I know that lots of people have had very, very bad cases. I'm not trying to minimize it at all, but most people that get COVID do have mild or moderate cases. So I also thought that this would be helpful because I know we keep reading and hearing about COVID cases and the rising and the Delta variant. Well, this is a screenshot as of today, and this is available to all of you at any time. You just go to that, the cdc.gov/COVID-data-tracker, and you can look up anything you want. And this is from the CDC's own website. I know we're hearing a lot about cases, the media talks about it constantly, but the deaths really have been very much on the decline since January. So please keep that in mind. I know we want to be very careful. We want to be very mindful about protecting ourselves, but deaths are absolutely down. And so this was pulled today, and you can go on all of that information. And I actually included that website. In fact, I'm going to just take a quick moment and put that in the chat in case you want to copy and paste it just for your own information. So you have it if you'd ever like to take a look at any of this data, and that way you have it. But I'm not saying it's not serious. It is. There's a lot of people have been harmed by COVID, but the numbers for deaths are definitely down. Definitely, they were very high back in the spring of 2020, high in the winter, and now they really are down. So it may give some folks a little bit of peace of mind and maybe worry a little less. Focus on what you can control. What can you control today? What can you control? And I know it's hard we do have control over what the thoughts that we think. My husband is really, really good at that. When I'll start talking about worrying about something, he'll say, why don't you just think about something else? And I'm really lucky I have him because I tend to think about negative and worry. And he's always like, well, why don't you just think about something else? Think about something more positive. And when I really try to practice that, it works, but it can be challenging. But what can you do now? What can you do to feel better, to feel healthier, to feel more at peace? Be mindful. So in Cruising Through Caregiving, I write about the BANWTH, the boring advice nobody wants to hear. Be mindful about it. Nobody wants to hear this. We all know it. We don't want to hear about it. But truly be mindful about your diet, your exercise, your sleep, your caffeine intake, your alcohol intake, making sure that you're managing any chronic conditions that you have and doing whatever you can to reduce your stress. Meditating, if you're somebody that prays, if you're somebody that, walking is helpful for you, but do those boring things that everybody knows about, but we're not all always good at. And if anybody has any thoughts on that, feel free to write in. And a lot of data about people sleeping less because of the pandemic. Make sure you're engaging with others who you love and enjoy safely based on your risk tolerance. Everybody has a different risk tolerance. And I think that that's not always discussed in the messaging about COVID-19. Remember, with experts, not everybody has the same opinion, but it's also the same as your friends, your family, your neighbors. Not everybody thinks the same. We all have to try to give each other a little bit of grace right now because everyone's going through a tough time. And I sincerely hope that your friends, your neighbors, your family are giving you a lot of grace because you're already been dealing with a lot before the world turned upside down. So again, integrate whatever healthy coping mechanisms that you've limited, consider what makes sense for you based on your risk tolerance. Consider doing a gratitude and silver linings list. And so I want to ask, has anybody experienced a silver lining since March 2020? Feel free to write in the chat section. And if so, what was it? Oh, you got married, Laura. Congratulations. Oh, Joanna, I'm so sorry. I'm so sorry. So, oh, Beverly, no silver linings at all. And you know what? That's not unusual. There are a lot of people. So I know a lot of professionals who were able to work from home. They've said, oh, that's a silver lining. Or I'm spending less money because things are closed. So that's a silver lining. Oh, Laura, I'm so very sorry. So many of you are saying no. So, and I ask that because as awful as this time has been, some people have, and Susan's saying you became a grandmother and one of your sons also got married. But I know that some people truly have not. And when I ask caregivers that question, a lot of people say no. So, Karen saying FaceTiming with your granddaughter. I think that for some people has been a silver lining, embracing the technology. Again, Zoom is never going to be a replacement for in-person, and we're not intended to live our lives on Zoom indefinitely, for sure. But it's important if you did have a silver lining or you do have some, to try to focus on them. Randy said, learned how to put mom's hair in curlers, and you've been able to finish several books. And again, I'm not trying to minimize the difficulty and the trauma. Karen's saying her husband was taken off a lot of his medicine. He's more alert now. Joanna's saying she retired in June, which could be a silver lining, but you'd rather be busy. So Joanna, I think one of the most dangerous things for all of us is too busy of a calendar, but also too empty of a calendar. Think about how you want to fill your time, because too much empty time, too much time to scroll on social media or watch all the 24-hour news cycle, it's not good for us. So really be thinking about how do you want to fill your time. BJ said, being forced to embrace technology has been good for you. So I want everybody to really be thinking about what you want your best life as a family caregiver to be. Do you need to revisit what your risk tolerance is? Do you need to, if you're conflicting with your loved one's healthcare provider, do you need to find somebody new? Is it time to look at senior living? Is it time to maybe move your loved one or bring help into the home or join a support group? What's one small step that you can take? And what's one small step that you can take that if your stress level, some of you said your stress level is a 95 today. What's one small thing that you can do to get to an 85 by tomorrow? Is it meditating? Is it reading? Is it taking a walk? Well, probably not tonight because of this crazy weather we're having. Is it reconnecting with an old friend? Is it making an appointment with a psychotherapist? What's one small thing? Laura's saying seated yoga. Val says being forced to do chores has made you physically stronger. That's a silver lining for you. Great. So what is one small thing that you can do to maybe not engage with somebody that disagrees with your perspective right now? Karen says ice cream. I like that one. So what I would like to let you all know is there's two things. So one, if you go to cruisingthroughcaregiving.com, you can get a free chapter of the book, as well as all the worksheets from my book. And also, hang on one moment, I'm going to put this in the chat section. I want to give everybody a less than 1 minute, a survey, if you would like to give any feedback about this evening. So the survey, you just click on that or cut and paste it, and you can give some feedback if you would like. It will take you less than 60 seconds. BJ also says music. Yeah. Karen said meditating again. And then I'm also going to put, so the Survey Monkey's in there, and then cruisingthroughcaregiving.com. I did want to let everybody know I'll be back in December. We have it planned that I'll be at the Annapolis Senior Center, which I'm so excited for, and I hope so much that it happens. But during that program, Bravia Senior Living is giving copies of Cruising Through Caregiving to all participants. So I would love to see you in person. I would love it. I hope that we get to do that. So I wish you all peace of mind and health and happiness. And I really appreciate the opportunity to be with you all here this evening. And I'm going to turn it over to Mary to wrap us up.
Thanks, Jen. And just to kind of go along with what Jen was saying earlier, one of her suggestions might be support group for you. And we're still doing our support groups. We do them twice a month. We're doing them virtually. Our plan is in October that we're going to get back in person. That's our plan right now. But even when we're in person, we're going to continue to keep the Zoom element, because we know for some of you it's difficult to get there in person. So that's been one of our silver linings of learning how to use technology and learning how it works better for some folks. So we plan to really keep both avenues open with our workshops and our support groups. So we hope to see you participate whichever way you can.